let me introduce myself. My name is Marty Melville. I'm a registered nurse. My background includes working in community hospitals, mainly on the West Coast. My assignments consisted of emergency and pre-hospital acute care, management, and education. I currently work as a holistic nurse while pursuing higher degrees, including forensic psychology. That is a task list of what I do, but it is not who I am. Think about that for a minute. Many of you state, I am a nurse, when asked what you do for a living. Do you know what that really means to you? Does being a nurse mean the job you do, or does it mean something else? What about you as an individual? What drives your desire to be a nurse? Let's talk about individuality and diversity in the nursing field. Specifically, let's look at you, who you are, and what you offer as a nurse individually. I'm not talking about the tasks you are able to perform, the skills you have, or the knowledge you possess. I'm talking about what encompasses who you are and defines you as a nurse. So, what do you bring to the table? Have you considered the answer to that question? Take out a sheet of paper, fold it in half, and on one side of the fold, write down all of your traits that you consider yourself strong in. I'm not talking about skill or tasks or knowledge. This is a list of characteristics you possess that make you special as a nurse. Perhaps some of you will list the ability to make your patients laugh. I had a coworker who was able to do just that in very stressful times. His ability to be stand-up comic-like in a very stressful situation alleviated a lot of the tension for a patient. It was a gift that he possessed. It's a gift I do not possess, but I appreciated what he would bring to the table in those situations. Perhaps some will list your ability to help another calm during stress. Again, a very special gift, but this time, perhaps your gift is the ability to de-escalate. Here, I worked with a coworker who had that ability to de-escalate those patients who were unable to calm themselves. The physicians in the department called him the patient whisperer, because he knew exactly how to speak in a very soft tone, how to be able to get close enough to the patient to allow the patient to hear the kind words and the reassuring words that he had to offer. This is ability that I do not possess either, but I appreciate his ability to calm down those who could not. Perhaps some of you will list your ability to help another, mentor, and guide. Let me tell you a story about one of my strengths. While working in the ER as a brand new nurse, on a typical day, we would have many code blues. This was such a day. My patient assignment consisted of what were considered minor complaints: stomach ache, sprained ankle, sutures, those kinds of things. They were not considered as exciting as a cold blue for a new nurse, which is what I was. As the clamor continued down the hall, dealing with the code blue, I found myself looking out of my patient's room to see what was going on. I had not been asked to be a part of the code blue team for that particular situation. I wanted to be. I felt left out, in fact, and felt that I should have the opportunity to learn what I needed to learn in a code blue. As the chaos continued and noises filtered up from down at the end of the hall where the code blue was being conducted, I forgot about my patient, who was lying on the gurney next to where I was standing. Suddenly, very quietly, I hear a little voice say to me, "Am I going to be okay?" In that moment, I realized the most important thing I could do as a nurse would be to reassure her and help her feel comfortable in a very chaotic, scary situation. Fortunately, I had the time to sit with her, hold her hand, and talk to her about what was going to happen to her next. Focusing on my patient and being able to provide that kind of guidance and mentorship helped me identify one of my strengths: to compassionately support my patients. It is something that when I identified, I have been able to utilize throughout my entire career. Your identity as a nurse takes time. It's a process that requires introspection and healthy recognition of your strengths and your weaknesses. Elizabeth Friberg quotes Krieger and Godfrey when she states, quote, "Like any life experience, professional identity formation is a process, not an event, nested within everyday experiences." Now, on the other side of the fold of your paper, write down your thoughts as we talk about the following questions. First, ask yourself the question, why? Why are you a nurse? Take a moment to jot down the first answer that comes to your mind. I can answer that question regarding myself. Why am I a nurse? Because I want my patients, their families, and associates to leave my presence in a better place than when they arrived. Number 2, now ask yourself, how? How do I accomplish that? Referring to the first question. Again, jot down that answer below the first. Again, I will answer for myself by providing excellent care, enriching myself with education and skill, and showing compassion for those around me. Finally, ask yourself, why? Why does all of the above matter to me? Write down your first impression. For myself, the answer, it matters, because I genuinely care about people. I care about their suffering. I care about helping others to be successful and to be at peace. My strength is in recognizing and providing emotional support, even mentoring others. You also have strengths. The answer to these questions will be individual and personal to you. They are crucial to understanding what a nurse is for you. Remember, these traits go deeper than the tasks nurses perform. These characteristics that you identify define you as a nurse. Nursing is a team effort. We can't be everything to everybody, but we can combine our strengths and support one another in weaknesses to provide an excellent outcome. By identifying the areas in which we flourish, we can work with others to create a well-rounded, excellent care. Think of it as a jigsaw puzzle. Each of us hold a piece or two or possibly more that we can bring to the table, our innate being as a nurse. These strengths identified through the questions above piece together with other nurses' strengths to create a whole. Margaret Christopherson quoted nurses who were interviewed about the subject of longevity in the nursing profession. This is what one nurse had to say, quote, "As nurses, we share skills and experience, and we help each other maintain professionality. We identify each other's professional strengths and limitations and coordinate the tasks in line with the individual colleagues' resources." In the same article, another nurse stated, quote, "As a professional nurse, I must be person-centered and provide holistic nursing care. And this again has enriched and strengthened me as a person. I learn to know myself, my own reactions, thoughts, and feelings. If I give much of myself, then I receive the same back. As you can see, nurses agree that each have something of value to offer to the profession. Recognizing your innate reason for being a nurse will allow you to understand your purpose, foster a greater desire for additional learning, and build on colleague relationships that will benefit you and your patients. Look for your intent. That is the answer to the final why question. Once you have identified your personal intent, your professional identity will be solid. Have a great life as a nurse.